Hi, I'm Ryan-Haddad and one of the co-authors of the Depression in the Elderly article. And it's important, I think, as a topic to talk about depression in the elderly for the formulary readers. So many elderly are affected by depression, and studies have shown depressed elderly have a higher incidence of morbidity and mortality with increased use of healthcare resources and costs. So pharmacists have a professional duty to ensure they receive optimal pharmacy care in their treatment of depression. Depression in the elderly, there are different treatment approaches differ from younger adults. Diagnosis in the elderly may be more difficult due to coexisting chronic medical conditions and medication use. They may have disability or cognitive decline, so that makes it a little more difficult in treating. Depression in the elderly population is widespread and is often underdiagnosed and inadequately treated oftentimes. Healthcare personnel who oversee care of the elderly may not be equipped to recognize or treat patients with depression. This may be due to the presentation of depression in the elderly, which may be atypical, and that may be often. They may have insomnia, anorexia, and fatigue as opposed to maybe the typical depressed mood reported by younger depressed patients. And rather than reporting they're feeling sad or depressed, elderly may have more somatic complaints such as chronic pain, weight loss, headache, or gastrointestinal symptoms. The elderly often dismiss their less severe depressive symptoms as an acceptable response to life stress or maybe part of the normal process of aging. However, depression is not a normal consequence of aging. Late-life depression, when untreated, has a significant impact on a patient's quality of life, healthcare resources, their functional status, as well as morbidity and mortality. Late-life depression should be treated with antidepressants that are safe in geriatric patients and carefully chosen to meet each patient's needs. When treating elderly patients with depression, it's important to remember that although they may respond to therapy as well as younger patients, the time to full response may require up to 8 to 12 weeks. For a first-time depressive episode, treatment for up to 2 years may be required. Elderly may be more susceptible to side effects of medications for depression, so we need to be cognizant of that. There are several things pharmacists can do, important services for our older patients with depression. We can be providing educational information about depression and antidepressant medications, which could enhance medication adherence. Additionally, monitoring patients for medication effectiveness, side effects, and their adherence could improve treatment outcomes. For patients who are not aware of or have not sought medical care for depression, we can really encourage them to make an appointment with their primary care provider for assessment. And because we are the most accessible healthcare provider, pharmacists are in a unique position to inform patients and assist in recognition of depression. We can offer screenings, provide education, and offer support to the elderly patients that we serve who may be suffering from depression. We can monitor for their somatic complaints that might indicate undiagnosed depression. And as pharmacists, we should be cognizant and able to recognize comorbidities and medications that might be contributing to a patient's depression, especially those older folks. We can advocate for their patients to discuss their symptoms with their primary care providers. For those patients receiving medication therapy for depression, we should be mindful of potential drug disease interactions, as well as side effects. We can be monitoring refills to ensure medication adherence, and we could be counseling patients about the possible need for continued maintenance therapy. Pharmacists may also consider innovative practices or treatment or outreach opportunities, such as community presentations on the signs and symptoms of depression, developing a call intervention for elderly patients who may be taking antidepressants, offering medication reviews to determine if there's potential medications or medical conditions that might be contributing to depression, and then as well as offering medical brochures or educational brochures in the pharmacy, and also collaborating with primary care providers in the community to provide free screenings.